welcome to Queers Queries,
where these queers
answer life's queries.
Ours
and hopefully
yours. Me, la 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 la. Okay. So what are we talking about today, Emery?
We are talking about mental
Mental
health.
health.
Here's the thing, is I feel like a lot of people have a lot of mental health issues, and there's a lot of negative connotation to mental health. Like, oh, she's got some...
Yeah, exactly.
Yeah. Cool. So there's a big negative stigma attached to mental health. So I feel like a lot of people don't ask for the help that they need. Or if they do ask for help, a lot of people tell them, oh, I don't think you're, that bad off. Like, things aren't bad for you, so you should be fine.
Like, you have a really good life. I don't know what your problem is. Just be happy.
And it's not that easy for some people. A lot of people that I know, and myself included, struggle with a lot of mental health issues. And I feel like if more people talked about it freely, I feel like more people would get help and be doing a lot better. Personally, I've been struggling with mental health as long as I can remember. I was severely OCD as a child, organized my money by serial number. When I got into high school, I struggled a lot with depression, and I talked to a lot of people about it and didn't really get a whole lot of help until recently. I've had a couple of really good therapists that have been amazing, and I feel like there's a lot of negative connotations that go with therapy as well.
Oh yeah.
How did I get from mental health to frostbite?
So this is a game Jess I like to play with Jess nowadays. Silent.
How do we get there?
Yes.
How
I
did we
love
get
how
here?
we get there. I have struggled with depression since I was like 12 or 13.
Been there.
Some of that was
Situational.
and external.
The key is finding someone who will listen and will be effective.
I love to talk. I love to talk about myself. Welcome to Queers Queries. We love to talk about ourselves. And I knew that for me it was going to be super helpful to
get it out.
Like, I really strive for validation even now, and I need
Wonder
it.
where that comes from.
And so I knew talking to someone to teach me how to deal with it. It was always you're too emotional, you need to calm down, you're being irrational.
Your feelings aren't valid.
Your feelings aren't valid. After a conversation with my therapist yesterday, because she was saying you need to validate yourself.
Self-talk.
Self-talk.
And I feel like it's one of those things that you see in movies, and it's always the crazy person that has like the post-it notes like, you are awesome.
I write on my bathroom mirror.
Yeah. Talk to yourself like you're your own friend. And it sounds insane. If I talked to my child the way I talk to myself, I would be an unfit parent. And one of the things literally that we talked about in group today was shame. Brene Brown, check her out. She's amazing. She's behind the whole DBT movement. She's written multiple books. But the 3 things that feed shame, that will make shame grow exponentially, is secrecy, invalidation.
I don't want your butthole
there she
on
is.
me.
Okay.
Take it away.
Away.
Fudge, what was the 3rd thing?
You're describing me right now.
Yeah. Oh, DBT would blow your mind.
Yeah, probably.
Like,
so as I was having this epiphany today, and then I was like trying to think of when I lost complete trust in myself. And I was kind of starting to realize, and the first thing that popped into my head is people giving me shit for my hangry. More often than not, I will say, just because you think I'm hungry doesn't mean I'm not angry.
Yeah.
And
just because my feelings are magnified right now doesn't mean they're invalid.
Because I haven't eaten in
20 minutes.
And that's just like my mom telling me that I need to calm down and stop being mad.
Calm down. You're not mad. Why are...
That I never learned was how to express my anger properly.
It's okay to be mad,
Mm-hmm.
but what we work with our kiddo is you can be mad. You just have to use your words.
Right.
So I know how you're feeling.
Mm-hmm.
It's like emotion regulation 101 when kids are developing is they know what they want, they know how they feel, and they... Why is she so gross? I can smell it.
She is.
She needs to learn how her emotions work because right now she knows what she likes, she knows what she doesn't like, she knows how she feels, she just doesn't know how to express it or control it.
I was told to just shut up and calm down.
Yeah.
And then I internalized it all, and over time I've just gone, clearly I'm the ridiculous one and I should just shut up.
One of the things...
Anger is also a secondary reaction.
Secondary
So-
emotion.
Yes, secondary emotion. So one thing that I really try hard to do is evaluate, why am I angry? Where is this stemming from? And then working on that emotion.
The express purpose of anger is to let you know that a goal or purpose is being blocked. Like something that you want to happen isn't happening. Sometimes it's fear-based, sometimes it's sadness-based, sometimes it's somebody really hurt your feelings, so you're lashing out.
I mean, the hard thing about dealing with your mental health is that there is no quick fix to it ever. It's taken years for you to get you or us or whomever to get the way we are. And then you have to recognize your issues. It's figuring out how to move forward with it and how to resolve it within yourself. And it takes so long to do because there's so much to deal with.
And it's not always going to therapy and getting your label and then working through what you have. And I mean, I was diagnosed bipolar for years. And then I saw my newest therapist, who's amazing, and she blew my mind when she suggested maybe you have severe depression and your mania is you being normal. When I'm medicated for my depression, it balances a little bit better. But the point of the story is don't focus on the label. Focus on the recovery. Like what you need to work on to make yourself a better person. Because you can always do better.
What is your family motto?
Our family motto is Team Williams, we're doing the best we can.
I keep sorry, I hit the thing. I keep a quote at my desk from Maya Angelou that says, you did what you knew how to do, and when you knew better, you did better.
Yeah.
If you are struggling with some kind of mental illness, educate yourself about your mental illness. Really try and get in tune with yourself and figure out what are the situations in my life that have kind of brought me to this point, and then what can be done to fix them. Even the most self-aware people are not going to be able to figure all of it out. You need an outside perspective.
You need an outsider's perspective. And the thing, so I loved my old therapist. She was awesome. My new therapist, the biggest difference between the two is that she kicks my butt. She's like, this is what you're doing, and I can see it, and this needs to change. You have to find what works for you, and what worked for me 10 years ago is not what works for me now.
Yeah.
I could have heard somebody be like, you know what, you need to check yourself and actually work on yourself at some point. I would have cried about it. I would have been so upset. I would have been like, oh, she doesn't like.
You know, I've been dealing with all of this for 20 years, and I just now got a therapist. And
I've been telling her to.
I know. I think I'm in the same boat as you. I think if they would have told me the real deal, then I would have been like, you don't even understand. You're not listening to me.
You can't go in expecting somebody to fix your problems without...
And they won't fix them for you.
They won't fix them for you. They're going to give
It's not their job.
hopefully, give you the tools that you need to help fix yourself.
Because it's the long game.
It is all about the long game. It's not quick fixes. Psychiatrists go for the short game.
Mm-hmm.
They want to
Medication.
hear your symptoms to know what medication's going to work for you.
Like it's an infection.
Like it's an infection.
And they're prescribing antibiotics.
Exactly.
So medication it can be very important for
And
some people.
It's not the end all be all.
Mm-mm.
And for some people, it's just a leg up.
Mm-hmm.
Sometimes it gets you where you need to be, and then you're like, you know what? I think I got this.
Mm-hmm.
And sometimes it's your chemicals aren't right in your brain, and that's just where you're at.
Mm-hmm. And I hate the stigma of this is altering my brain chemistry. That's the point.
Something's wrong.
Something
Something jacked
is
up in my brain chemistry.
in your brain chemistry.
If you want me here, you'll have me on medication.
Uh-huh. But talking to someone
That's
is
the biggest thing, whether it's a friend or a family member
Mhm.
or preferably a trained professional, but sometimes
someone. I would suggest
someone you trust.
and it is scary and it is hard. I suck at it.
Being open and honest is like ripping a bandage off a gunshot wound.
Everything's gonna come gushing out all
Yeah.
at once.
Okay, yeah, you have this gunshot wound,
Mhm.
which is your depression, your OCD, your ADHD, your whatever. And
And your silence is the Band-Aid.
your silence is the Band-Aid. It's not fixing anything. It's just keeping other people from knowing that you're slowly bleeding out. And you're going to have to rip off that Band-Aid. It's going to be bad. It's probably going to leave a scar. But it needs to be done for it to heal. You're going to be a whole person again. Is to help yourself, like by talking to someone.
We have both been in that place where we did not think anything was ever going to change or get better. And that hopelessness is a f***ing liar. It will tell you, yeah, you're absolutely right. Nothing is ever going to get better.
This moment does not go past this moment. All you have to do is survive this moment. And it's when you're in the moment, it's so impossible to see outside of it.
It is, but you have to figure out a way.
Yeah. And whatever it is to pull you back, focus on that. Like, these are the things that keep you alive. You're welcome. Ask for help.
Ask for help. Talk to
Message us. We're not trained professionals.
No, but I mean,
but
we've
been
been there.
through some stuff. Just talk to somebody.